Hi again. After a long time, I'm trying to do a new one on dementia. I actually have a desire to do multiple of these videos on dementia because I do see it every day. People that are getting older and older and have dementia. And after developing severe dementia, people have problem recognizing their loved ones or even using a pen or using the spoon to eat or feed themselves. Again, this is only an advanced case of dementia. The dementia is a loss of memory. The commonest cause, of course, is Alzheimer's disease. And multiple theories have been proposed for causes of Alzheimer's disease, including presence of tau protein, lack of sleep, smoking, alcohol, lack of exercise. The medicines that have been tried have been okay, but not greatly successful in preserving, let alone reversing the disease. So disease cannot be reversed. It is known that as we age, the number of brain cells go down, and that may be causing the problem. However, there are more than this simple explanation as the cause of dementia. So the commonest cause is Alzheimer's dementia, but there are more. One is vascular, mini strokes or atherosclerosis of small blood vessels supplying the brain cells causing the problem is also thought to be one of the problems. Everybody probably knows about dementia seen in advanced Parkinson's disease, and then there are other causes of dementia which include, or at least nomenclature-wise, supranuclear palsy, multiple system sclerosis, and of course Lewy body dementia. The common factor among all this is that the life becomes more and more difficult as memory for common things goes down, and the cognitive function decline occurs because of lack of memory. The question that often is asked is, where is the memory stored, or how do we recollect instances? And that has been a challenge. The hippocampus and some of the areas in the other areas of the brain are thought to be so. So the people that smoke, people that drink excessive alcohol, people that are exposed to various toxins, some people blame it on processed food, and then there are other causes including genetics. The reason for me to talk about it today is that I wanted to mention some of the newer or recent investigations that have been done on it. And I'm going to talk about exercise. There are other treatment modalities for the dementia, but exercise seems to be one of them, which is without any cost. So there are standard tests that are done to analyze whether people have memory or not. Most of the experiments are done on rodents or mice to see whether they improve upon the memory, and a particular type of maze, sometimes a T-shaped maze, or some other ones are done. Certainly everybody can understand the word event memory, remembering about event. And then there's another term which is used called spatial memory, or space, where you are, or if you pass something and you can come back and recollect that you were there. Again, these two are tested in rodents in the many studies. These are essential for the performance of cognitive function, day-to-day life, and of course if you are employed or working, then that is also very important. There are tests that are given which are standard tests, and the scores can predict if somebody is borderline or somebody is developing dementia or somebody is really worse. And these tests are used to see the effectiveness of the therapy. So I'm going to talk briefly about exercise. Again, there are more than other causes, but one of the things which is cheapest is doing an exercise. So an article which kind of stimulated me to talk about it. There are more than one articles, but I saw a few of them recently. One of the articles suggested that doing an aerobic exercise reverses the dementia or improves the memory related to the space or event. These are the two different kinds of memories that we have talked about. So the study was done which showed that they took several people. In one of the studies, they had a control arm where people did engage into exercise, but that involved stretching and toning. That means doing some weights. But it did not involve aerobic exercise. They measured the volume of an area of the brain called hippocampus, and they found out that when people are aging, we lose 1 to 2% of hippocampus volume every year as we age. They also found out that the perfusion also goes down. That means the blood supply goes down in certain areas of hippocampus. When people engage themselves in a aerobic exercise 3 times a week, they found out that the volume of the hippocampus increased. The stretching and toning exercises did not improve the volume of the hippocampus. But the aerobic exercise 3 times a week did improve the volume of the hippocampus. The follow-ups were 6 months to a year, so certainly it was long-lasting. And if you remember, when I have talked about the exercise, I've talked about 3 kinds of exercises. One is stretching, which is for flexibility. Second is muscle toning, which is good to prevent osteoporosis or improve osteopenia, and also preserving the muscle mass. And third one is aerobic. The aerobic exercise is where your heart rate goes up and it is maintained at a certain level. If you remember that when you calculate the maximum heart rate, if you take your age, 220 minus your age is the 100% accepted heart rate. If you have heart problems or if you're having any other issues, you can cut it down. But maintaining a heart rate somewhere around 75-80% of that particular thing for a length of time would be considered as aerobic exercise. And doing that exercise, provided you don't have cardiac issues or lung issues, will cause you to preserve the hippocampus volume. The volume measured on MRI scan of these people that did aerobic exercises 3 times a week literally looked like they preserved their volume for 2 years. That means your memory loss was prevented for 2 years. So if you're 70, it was 68 age memory hippocampal volume. Certainly the chemicals were also measured and they also improved. Again, when they tested people for the space or spatial memory and event memory on the testing, both of them improved. So the best advice that I can do for people that have early onset memory loss or those who are trying to prevent the memory loss, one should engage into an exercise schedule which includes aerobic exercises at least 3 times a week. And this should be done all the time because that is going to preserve the hippocampus volume and hopefully prevent the memory loss or reverse the memory that you might have lost. The other 2 types of exercises, the stretching and toning, are also important for physical maintenance of the body. So aerobic exercises does improve the cardiac function, pulmonary function, and memory, while stretching and toning improves the physical function of the body. Thank you for watching. I would like to do a little bit more on this dementia in the future. Hope you like it and subscribe. Thank you. Have a nice day.